Editing a hands-on treatment. Click the top blue tab, Hands-On. In the left vertical pane, click Public Hands-On. Choose the type of treatment, HVLA, High Velocity, Low Amplitude, LVHA, Low Velocity, High Amplitude, LVLA, Low Velocity, Low Amplitude. We will select HVLA. Select the body area that the treatment is for, cervical, lumbar, extremities, etc. We will choose Cervical HVLA by clicking on it in the left vertical pane. Observe the gray pane to the right is now populated with treatment icons. Right-click on the treatment icon you wish to edit and click Copy. We will choose Sitting Cervical Transverse AP Move. In the left vertical pane, click My Hands-On. In the gray center pane, right-click and click Paste. Note the Sitting Cervical Transverse AP Move icon is now listed in the gray screen. Click the Sitting Cervical Transverse AP Move icon in the toolbar above, click Edit. The Hands-On wizard is now open. Note, to the bottom left, there are 11 buttons, each account for a different part of the treatment. We will change the difficulty of this from medium to easy by clicking in the right bottom gray panel in the options. Note difficulty is determined by clicking a radio button signifying the level of this particular treatment. Note boxes in red in the top left portion of the screen directly relate to the items in the bottom right panel. The wizard will highlight the part of the treatment you are editing by indicating it in red in the top left panel. Click Next. The pictures will not change, so click Next. The next option is Area Treated. We have neck selected, but this can be edited to indicate muscle tendon, bone joint, or landmark contact. We will change this from neck to cervical by clicking the green tab, Bone Joint, click the icon named Cervical, and click Next. Note the body area treated in the top left panel has now changed to cervical. The patient initial position described as sitting. We will add a secondary position of head neutral to further explain the position the patient begins in. Click Next. Note, in the initial position, it now has sitting and head neutral directly underneath it in the top left panel. We will click Next to move through the wizard for the areas we are not changing, including doctor's initial position, patient's contact, doctor's contact, patient's movement, doctor's movement, and patient's final. The last button for the wizard, Add Precision to your technique, enables the user to add options for notation in the treatment. Observe the bottom right panel has changed. Bottom gray area represents what will be seen below the treatment in the player. Click the green tab above Elements. We will add a text box to allow the doctor to type notes for the treatment by clicking Text Area and dragging it to the gray box below. Click the new element, Text Area, and a dotted black line will surround it. Note, when we clicked this, the green tab above changed to Properties. Below Common Settings, double-click in the right column, Custom Text. Delete custom text and type Notes. Hit Return after to save the new label. Click Close. Click Save and Close. Observe, the new treatment populates the gray area of the My Hands-On.